Very good evening to all my dear students who are waiting for this virtual platform class. അപ്പോൾ എല്ലാവരും സന്തോഷമായിട്ടിരിക്കുന്നു, സമാധാനമായിട്ടിരിക്കുന്നു, സുഖമായിട്ടിരിക്കുന്നു, ആരോഗ്യമായിട്ടിരിക്കുന്നു ഒക്കെ വിചാരിക്കുന്നു. അപ്പോൾ നമ്മുടെ 23rd virtual platform ക്ലാസ്സിലേക്ക് നമ്മൾ വരികയാണ്. So I welcome all on behalf of our Be Good family. Hope all are doing good and fine. Okay, so it's me again, Abhilash Vijay Mohanan Nair, Senior Faculty of OET from Be Good family. കഴിഞ്ഞ കുറച്ച് ക്ലാസ്സുകളായിട്ട് 23rd സെഷൻ എന്ന് പറയുമ്പം ഓൾമോസ്റ്റ് ഓൾ സോർട്സ് ഓഫ് ടോപ്പിക് വി ആർ ജസ്റ്റ് ഡിസ്കസിങ് ഫോർ യു. വെരി ടഫ് ക്വസ്റ്റ്യൻസ് വി ആർ ഡിസ്കസിങ്, ലെങ്തി ക്വസ്റ്റ്യൻസ് വി ആർ ഡിസ്കസിങ് അല്ലേ. കഴിഞ്ഞ കുറച്ച് നാളുകളായിട്ട് ഇത് മൊത്തം കണ്ടവർക്കറിയാം, കഴിഞ്ഞ സെഷൻസ് എല്ലാം വാച്ച് ചെയ്തവർക്കറിയാം. നമ്മൾ കഴിഞ്ഞ കുറേ നാളുകളായിട്ട് ഡിഫിക്കൽട്ടായിട്ടുള്ള ക്വസ്റ്റ്യൻസ് തന്നെയാണ് ഡീൽ ചെയ്യുന്നത്. അതുപോലെ തന്നെ എന്താണ്, ലെങ്തി ബൾക്കി ആയിട്ടുള്ള ക്വസ്റ്റ്യൻസ്. ഓബ്വിയസ് കൺസേൺ ഓഫ് അവർ സ്റ്റുഡൻസ് ആർ ലൈക്ക് ഹൗ ടു ഡീൽ വിത്ത് സച്ച് എ ലെങ്തി ടോപ്പിക്, ഹൗ ടു ഗോ ഫോർ when some gigantic question comes. അതായത് വലിയ ക്വസ്റ്റ്യൻസ് വന്നു കഴിഞ്ഞാൽ നമ്മൾ എങ്ങനെ ഡീൽ ചെയ്യും എന്നുള്ളതാണ് കൂടുതലും കുട്ടികളുടെ കൺസേൺ ആയിട്ടുള്ളത്. ബൾക്കി മൾട്ടി ടാസ്ക് ക്വസ്റ്റ്യൻസ് വന്നു കഴിഞ്ഞാൽ എങ്ങനെ. അപ്പോൾ നമ്മുടെ കഴിഞ്ഞ ടോപ്പിക്കുകളിലെല്ലാം നമ്മൾ ഡിസ്കസ് ചെയ്തിരിക്കുന്നത് അങ്ങനത്തെ ക്വസ്റ്റ്യൻ ആണ്. അത് കഴിഞ്ഞ സെഷൻസ് ചെയ്തവർക്കറിയാം. We are getting many frequent feedbacks and they are sending us questions. All those things they are getting us. അപ്പോൾ എല്ലാ അങ്ങനത്തെയുള്ള ക്വയറീസും കൺസേൺസും അപ്രീസിയേഷൻസും ഒക്കെ നമുക്ക് കിട്ടുന്നുണ്ട്. So I'm always focusing on discussing such sort of questions that you may very difficult to cope. ഓക്കെ, അപ്പം നമ്മൾ കൂടുതലും നമ്മുടെ സെഷൻസിനകത്ത് നമ്മൾ ചെയ്യുന്നതെന്ന് പറഞ്ഞു കഴിഞ്ഞാൽ ഇതുപോലത്തെ ആയിട്ടുള്ള അല്ലെങ്കിൽ ഹാർഡ് ടു ഡീൽ ആയിട്ടുള്ള ക്വസ്റ്റ്യൻസ് ആണ് നമ്മൾ എടുക്കുന്നത്. അപ്പൊ ഇന്നും നമുക്ക് ഏകദേശം ഒരു ക്വസ്റ്റ്യൻ ഇസ് ഓക്കെ, ബട്ട് യു മേ ഫൈൻഡ് ഇറ്റ് ഇറ്റ്സ് ക്വൈറ്റ് ഹാർഡ് ഫോർ യു ടു ഗെറ്റ് ത്രൂ ദ ക്വസ്റ്റ്യൻ. അങ്ങനെ ഒരു ക്വസ്റ്റ്യൻ ആണ് നമ്മുടെ കുട്ടികൾ ഇന്ന് അയച്ചു തന്നിരിക്കുന്നത്, സ്റ്റുഡൻസ് അയച്ചു തന്നിരിക്കുന്നത്. അപ്പൊ എന്നിട്ട് എന്നോട് പറഞ്ഞിട്ടുണ്ട് മോട്ടിവേറ്റ് ചെയ്യാൻ എന്തൊക്കെ ഫ്രേസസ് ഉപയോഗിക്കാം, മോട്ടിവേറ്റിംഗ് ഫ്രേസസ് ആയിട്ട് എന്തൊക്കെ നമുക്ക് ചെയ്യാൻ പറ്റും, എന്തൊക്കെ പറയാൻ പറ്റുമെന്നൂടെ നമ്മളോട് ചോദിച്ചിട്ടുണ്ട്. So I'll be giving you some hints for motivating phrases, hints on motivating phrases, and even we could go for the question discussion, and later we will give the role play and can wind up the session. Okay, എല്ലാവരും സന്തോഷമായിട്ടിരിക്കുന്നല്ലോ. So the question will be displayed right now. Hi, good evening, Bonnie. The question is right there. So before the question discussion, let us discuss some clues that you could use, some hints or clues, some sayings that you can use to express your motivation, to how to motivate the patient. Okay, especially during confusion and all, no, we will be always asking the patient to stay alert, active and all, no. So what are all some statements that you can do? But express your motivating feels. Okay, how to motivate the patient. Patient എങ്ങനെ നമുക്ക് motivate ചെയ്യാൻ പറ്റും? ആർക്കെങ്കിലും എന്തെങ്കിലും clues ഉണ്ടെങ്കിൽ നിങ്ങൾക്ക് എന്ത് ചെയ്യാം? You could pin your comments over there. You can throw it in the comment box so that I could have a watch. അപ്പോൾ നമുക്ക് general ആയിട്ടുള്ള motivating statements ഏതൊക്കെയാണ്? നമുക്ക് എങ്ങനെ പറയാൻ പറ്റും? Be positive. That is the first statement. Obviously, almost all of the students would be cracking, like be positive. Okay, stay positive. Okay, be calm, stay relaxed. Okay, stay calm, be calm, stay relaxed. Okay, keep relaxed. Okay, don't worry, stay relaxed, stay calm, be positive. Okay, stay positive. Then what else? Any other clues if you're having means you can just get it to me. Okay, be optimistic. Okay, be optimistic. Okay, that is another thing that we are just saying, like be optimistic. Then what else? Okay, any other clues? Any other clues that you people are having? Yes. Okay, be optimistic, stay positive, keep yourself calm. Okay, stay relaxed, take rest. Even you can finally and all when we ask the patient, we can ask the patient to take rest. Okay, take rest, relax. Okay, be comfortable, be confident, be optimistic. Okay, stay confident, stay relaxed. Okay, keep yourself relaxed. Okay, don't worry. Okay, okay. You will be all right for sure. All right for sure. Okay, keep your positive vibes high. Keep your positive vibes high. keep your positive vibes high, positive vibes high. So all these things we can just throw in alternate. Okay, alternatively we could throw to improvise or to motivate the patient's feeling. Okay, and what else we can always have a ray of hope. Okay, okay, always have a ray of, we always having a ray of hope. Keep yourself active. Okay, to always have a ray of hope. You can ask to the patients like that. Okay, എപ്പോഴും ഒരു പ്രകാശത്തിന്റെ വെള്ളി വെളിച്ചല്ലെങ്കിൽ പോസിറ്റീവ് വൈബ് ഉള്ളിലിരുന്നോളൂ. Keep your positive vibes high. Okay, keep your morals high. MORALES, morals high. Okay, so these are some statements that you can throw to the patient to motivate their feels. Okay, so these are certain statements according to the situation. According to the situation, you can just ask the patient to, depending upon the situation only, you can give this motivation feels and all. So a patient who is awaiting discharge, or the patient is about to be discharged, the patient is in ward getting recovered from the surgery or whatever it is, we can always ask the patient to we can always this sort of statements. You can just alternately you can change and use the statements for motivating their feels. Okay, so it's okay. I hope you all have scribbled down those things. Okay, now you could throw the question maybe. Can give. So now we'll go for the role play discussion. Question take one. Okay, the question is displayed right there. You can have a look onto that. After that, I'll read. We will discuss the question. Okay. Yes. Let us start by discussing the question. Okay, the first setting is a community health center. Okay, so the setting here given as a community health center. Okay, and first, okay, the patient is 30-year-old university lecturer who has recently, that means 2 weeks ago, had her bowel removed due to Crohn's disease. Okay, and has been fitted with a colostomy bag. The patient's vital signs are fine. The surgeon has informed the patient that wearing the colostomy bag is irreversible. The patient appears depressed. Okay, first task is like meet the patient and ask how she or he is feeling. Okay, depending upon the gender of that examiner, we could decide the okay whether we could decide whether to address the patient as he or she. Okay, that is according to you. Yes. So this is a community health center. The patient is a 30-year-old lecturer. Okay. So 2 weeks back, bowel removed. The patient's bowel got removed because the diagnosis was of Crohn's disease. Okay, Crohn's disease ഭാഗമായിട്ട് ബബ move ചെയ്തിരിക്കുന്നു and has been fitted with a colostomy bag. Now the patient is running on colostomy bag. Okay, the patient's vital signs all are fine. So now for this community health center, the background information is given like all other things are fine. Okay, that means there are no other complications. Vital signs and all are fine. The surgeon has informed the patient that wearing the colostomy bag is reversible. So it is a permanent colostomy, N colostomy or permanent colostomy. This can't be reversed ever in their life. Okay, reverse back ever in their life. So this is for whole life. The patient is taking this. Okay, the patient is fitted with this colostomy bag throughout their life. For their entire life, they are continue with this colostomy bag. Okay, so the patient appears depressed. The patient appears depressed. Depressed in the sense appears depressed means, Makla, you all have always I used to tell my students, like, do have a close watch over the questions. Okay, so that means the patient is looking depressed. A certain sort of uncertainty we can just see on that patient's face. Okay, so already the surgeon has informed the patient, okay, that this is irreversible. Okay, that is what patient is. So we can just take the topic. Okay, we can directly address the patients. Okay, as a known case, you can start this because all those information are given there. As a known case, we can just start with the greetings and can inquire the well-being of the patient. First itself, we can start by addressing the well-being of the patient. You can ask to the patient. Okay, so my dear students, I know that a lot are watching me. If you have got any queries or concerns, any discussions, if you want, means please do pin your comments in the suggestions box. Okay, so that it would be more motivating for me. I could deal more interactively. Okay, so that is what interaction is possible. So through interaction, we can make the class more interesting. So make sure that you're drawing some comments. Just type it and give it to me. It's not a matter of asking questions or something. We will be just discussing all your concerns. Okay. Yes, so feel free to ask. So the first one is greet the patient. House as a known case, you can start this condition. Respond to the patient concerns, but explain why the colostomy bag is needed. So we should ask to the patient. We need to ask the patient's concern. Okay, we need to listen to the patient concern and explain them why it is needed now, why this colostomy bag is needed now. Okay, next one is like explain sympathetically that the wearing the bag is irreversible. Okay, so this bag is their entire life. It is in colostomy. Okay, so not loop colostomy, it is in colostomy, irreversible, permanent colostomy. This one is, so we need to sympathetically answer to that portion. Okay, we need to explain them. Already the surgeon has informed it. Again, sympathetically, we need to inform the patient. Okay, next, empathize with the patient while informing the patient that although lifestyle changes will be made, his or her fears are unnecessary. Okay, and explain why. Then give brief instructions about the management of stoma and bag. Okay, so after listening to all their can say that all their fears and their anxiety are unnecessary. There is no need to be anxious or afraid about this present situation. Okay, and we can give them the regarding the management of stoma bag. Okay, so tell the patient that community health assistance is available whenever he or she needs it. Okay, so we can assure them all sorts of supportive services, community assistance, stoma care, nurses, and all. We can see the hints are not there. That is a problem here. Okay, so for your exam, you can this sort of questions, but always there will be some sort of hints and points. Okay, you'd be able to deal it freely. Okay, fine. Ask the patient to come back in 3 days' time for another assistance session. In case if the patient is not able to, so we are seeing like if the patient is not able to cope with or they are not they are not satisfied with the sort of comments or advice that we are giving, we can ask them to come back. In case if they are having any more concerns, we can ask them to come back to our center after 3 days. Okay, and another assistant session, we can ask them to come there. Okay, that is what yes, so this is what the topic, okay, this is what the discussion would be. So the final conclusion, you have to deal in a different way. That is what the instruction is. Hope the situation is clear to one and all my dear students. I think the setting, the scenario, the tasks are all clear. So if you have got any queries, mates, I'll give you 1 minute time, so you can just throw it in the comment box. Any concerns regarding the question, means please do put your suggestions in the comment box, my dear students. Yes, put the question. Okay, my dear students, let's come back to the question. Okay, I hope all are there. So if you don't, no one is interacting with me. Only Bonnie is doing me, is getting me some questions. Hi, Ashwini Mane. Good evening. Good evening. Any question means you can just throw it over in the comment box. Okay, so that I could have a look and I'll be able to discuss it for you. Fine. So first itself, greet the patient and how he or she is feeling. Okay. So we can, so you need to, the patient appears depressed, that you have to keep in your mind, because that says our observation is, okay, that says our observation is we can catch that point and can address the patient's concern. Okay, so you need to address that because that is observation. The patient never say that they are depressed. Okay, on our observation, appears means observation. Okay, Ashika, good evening, Mane, good evening, all of you. Yes, so let's start discussing our role play. Fine. So greet the patient as good morning. So we can address the name. We can collect the name of the patient. It's a known case. We can move to the topic. Good morning, Mr. Martin. Please come. Be seated. Okay. Good morning, Mr. Martin. Please come. Have your seat. I'm Abhilash, Chaz nurse here. Okay. How you're feeling since surgery? Hope everything is going on well. Okay, is everything okay? Okay, so this is the way by which we can introduce a topic. You can give a pleasant and Christine, good evening, Mane, good evening. Okay, a pleasant introduction to the session. Okay, good morning or good afternoon, good evening, because no time indication is given there. Kalai Selvi, good evening, Mane. Everything is going on well, fine. So thank you for your interaction. So if you got any queries or concerns on this question in this role play, please put it to me. Okay, so that will be more happy. I can deal more freely, and it would be more enthralling. It would be more encouraging for me. Okay, when it comes to me, I'll be able to give you more effective lectures. That is what. Yes. So introduction of this topic is like, good morning, Mr. Martin. Please come have your seat. Okay, I'm Abhilash, the charge nurse. Okay, I'll be working with you today, whatever it is you can give like. Okay, I'll be working with you. I'm the charge nurse. Well, how are you feeling? Have you feeling since surgery? Is everything going on well? Okay, are you okay? Is everything going on well? That the patient is saying like, Animesh, good morning, Patnaja, good evening, Animesh, good evening, Patnaja. So the patient would be, we are eagerly waiting for the uh, patient's response. Oh, nurse, yes, I'm okay. It's going on like that. Okay, so they'll be, well, what happened? It seems you're depressed. Well, what happened? It seems you are depressed. So, always, I want all my dear students to care on your intonation. Okay, intonation is what the role play is. The meaning could be only conveyed. The real meaning could only be conveyed if you are good at, if you organize your intonation thought. Okay. Well, what happened? It seems you are depressed. What is bothering you? Tell me. Let me see whether I could help. Okay. So all these are the ways by which you can address the patient consent. Well, what happened? It seems you are depressed. See, the condition is given in the scenario like depression. The patient appears depressed. Well, what happened? It seems you are depressed. What is bothering you? Tell me. Let me see whether I could help. Let me see whether I could help. Okay. So that is how you should address the patient concern. Then the patient would be responding like, nurse, you know that I'm really very depressed and I am embarrassed regarding this. It is really embarrassing. Okay, I'm depressed, nurse. You're right. See, I'm very worried about this colostomy bag. Okay, why it is applied for? Why it is here for me, nurse? I want it to be removed. Okay, okay, so the question is, you want the question? Please send the question. Okay, Mane. So the question will be displayed right there. So many are sending me the things. Daisy, good evening, Mane, Animesh. Good evening, all my dear students. I'm happy that you people are watching. So any doubts or concerns, please to send it to me. Okay. Yes, the question is right there. So you need to see that the patient is asking why. Why, nurse? Why this is given for me? I don't know why I'm fixed with this. It's really embarrassing. I'm really depressed on this colostomy bag. Okay. So that is what the patients concern us. Okay. So for that first, so now we are just addressing the patient concerns. The patient have already expressed their concerns and worries. So now we need to address their concern. We need to catch their concerns. Okay. So what we can tell the patient like, yes, I understand. Yes, I understand. I know, Martin, it is very hard to cope. Yes, I understand. I know, Martin, it is very hard to cope. But in your case, it is very essential. But in your case, it is very essential. Okay, but in your case, it is very essential. You know that you are suffering from Crohn's disease. You know that you are suffering from Crohn's disease. Okay, so if the surgery is done, okay, the treatment, the surgery is done, okay, colostomy is there, the bag is there, okay, it allows, okay, it allows drainage of waste materials, okay, it is to facilitate the stoma, and colostomy bag is to facilitate drainage, okay, or the drainage of waste, okay, now to collect this facilitates the drainage of waste, okay, in your case it is very necessary, otherwise you may go for certain complications, okay, otherwise you may go for certain complications, okay, there can be blood clots, okay, bowel obstruction, huh? And all other complication and other serious health problems can be bowel obstruction, okay, blood clots. The risk of colon cancer is more in this case if there is no stoma has been, if there is no stoma means, okay, so there is risk for blood clots, blood cancer, okay, there can be bowel obstruction, okay, malnutrition, and certain other health problems could happen, and certain other health problems could happen. Okay, this can put you into complication. So now in your case, the most effective management is colostomy. Okay, so the bag, the colostomy, the stoma, the opening and colostomy is very needed. The bag is very needed to collect the waste. Okay, that is what. Okay, since you cannot defecate through the anus, okay, so since it is diseased, okay, so it is very necessary to have this colostomy bag. Yes, that is what okay, this is how we should convey or convince the patient. Well, yes, I understand. I know, Martin, it is very hard to cope. But in your case, the definitive management, okay, the most if the safe and best effective management in your case is colostomy bag. Okay, colostomy, opening and back, stoma and back is very, see, you know that you are suffering from Crohn's disease. No other options are possible. The surgery has already been done. The stoma has been made. Okay, so it allows drainage of waste materials so that the puke can be collected inside the stoma bag. Overall, it allows the normal functioning of the body. Overall, it allows the normal functioning of the body. Otherwise, you may go for some serious complications. Otherwise, you may go for some serious complications like bowel obstruction, malnutrition, blood clots, and the risk of cancer is more. Okay, so we cannot take chances. So in your case, it is very necessary to have this colostomy. Okay, the bag is also, the colostomy bag is very necessary. The colostomy and the bag is very necessary in your case. We cannot help you out of this. We cannot help you out of this. And so you could write all these sentences. Yes, all are getting me, my dear students. So this is how we are dealing with that second task. If the patient concern is like wearing that colostomy bag. Okay, so we have just given the explanation like that. It allows the normal functioning of the body. Otherwise, you may go for some serious complications, bowel obstruction, malnutrition, okay, blood clots, risk of cancer, and certain other health problems can happen. Okay, this could be life-threatening. So in your case, this is the best and safe effective management. We cannot help you out of this. Finish. Clear, my dear students? Okay. So the patient will be saying like, nurse, I have heard that this is irreversible. Irreversible. So I want to know whether I should carry it for my lifelong. I'm only 30. Okay, so the patient would be, at that time, we need to empathetically respond to the patient's concern. Okay, yes, you're right. Okay, yes, you are right. Yes, you are right. Whatever you have heard is true. Yes, you are right. Whatever you have heard is true. I think the doctor has explained you more about this. I think the doctor has explained you more about this. Since your colon, okay, since your colon is diseased, since your colon is diseased. So we are just never go for cracking any hard medical terms, which is very tough for other normal people to understand. Okay, never crack any medical words and all. Instead, you need to empathetically respond. Yes, you're right. Okay, whatever you had, yes, I understand. Whatever you have heard is true. I think the surgeon has explained you more about this. This cannot be. Okay, this is irreversible. This is a permanent colostomy. This is an end colostomy, a permanent colostomy. See, since your colon is diseased, you cannot defecate through the anus. Since your colon is diseased, you cannot defecate through anus. Okay, a portion of the colon is removed. A portion of the colon is removed. The condition cannot be reversed. The condition cannot be reversed. Okay, so as I mentioned, the best, the safe, effective option in your case is colostomy. Okay, it is irreversible, and I want you to be patient. Okay, it takes some time to cope, but you have to understand the situation and have to go along with this. Okay, okay. So we are just conveying the reality to the patient in a peaceful manner. Okay, so that is how we should convince the patient. Fine. So the patient may be expressing their dismay. Dismay in the sense, oh no, dismay in the sense they will be paribhrama. They will be having some sort of anxiety, panic, anxiety, all those things. Patient in the pattern, they will be anxious. They'll be expressing their concern and anxiety. Okay. Well, nurse, what about my normal life? Okay. What about my normal life? Okay. I really don't know anything about this. Okay. You want, okay. Please display the question. Okay. So the patient may express their dismay. Dismay in the sense they will be anxious, they will be panic. Okay. That is the thing. Okay. So we need explain those concerns with the patient. Yes. Uh, how to deal with that particular task, we need to empathize with the patient that lifestyle changes will be need to meet. Fears unnecessary are explained why. So their fears and their concerns are unnecessary. So we need to we have to listen to the patient's concern. Okay, they will be asking how I will be able to maintain close contact. I'm a teacher. I need to go for classes. Okay, how will I be able to socialize with the patient? Okay, all those things the patient would be asking you. Fine. So at that time, uh, you need to uh, explain the patient. Okay. So all those things, the patient, you need to explain it to the patient. Fine. Okay, so they are just worrying about their anxiety. They are very worried and they are very anxious about their situation. Okay, so that is the thing they are asking the patient. They are just asking us that how they will be able to lead a normal life. They are very anxious about their normal life. Okay, they'll be explaining you like, I'm a teacher. I will not be able to go for classes. Okay, all those things that you need to explain. Okay. So how we can deal with that particular task? Yes, tell me. Anyone is having any idea? Mr. Martin. Okay, Mr. Martin. I could say that your fear are unnecessary. You don't have to be anxious, Mr. Martin. I want to say that you don't need to be anxious. Mr. Martin, come on. Okay. Keep your positive vibes high. There you can just use this. See this empathetic phrases and all I have just discussed now, no? You can just do this motivating phrases. Okay, empathetically, there's motivating phrases you can do. Okay, Mr. Martin, come on. Keep your positive vibes high. Who told you that you'll not be able to lead a normal life? Well, you can really enjoy a normal life. You can resume all your normal activities. Of course, yes, you need to make some lifestyle changes. Eventually, you can lead a normal life. Eventually, you can lead a normal life. Osteomates, the term we can use, those who are bearing this ostomy or this colostomy bag are known as osteomates. Okay, you can just, oh, Mr. Martin, come on, keep your positive vibes high. Told you that you will not be able to lead a normal life. Of course, yes, you can. Well, of course, you can definitely lead a normal life. There is nothing to be worried about. There is nothing to be anxious about. Okay, no need to be afraid. No worries. You can definitely lead a normal, healthy, and happy life. You can resume all your normal functions. You can go to college, you can take classes, okay, you can socialize, and even you can have a comfortable um, sexual relationship too. Okay, even there is no problem in having your sexual relationship. You can continue your all the normal activities that you have. Okay, activities of physical intimacy or sexual relationship, you can um, just rephrase like activities of physical intimacy. Okay, osteomates can definitely lead a normal life. Okay, osteomates can definitely lead a normal life. See, nowadays we this ostomy bags. Okay, there are certain pouchings available for this ostomy bags. Okay, there are certain pouchings available for ostomy bags. Okay, ostomy bags. There are certain pouching available for ostomy bags. So the question is displayed right there. Okay, so there are certain pouchings available for ostomy bags. You can have inner garments according to that. Okay, there are okay, so ostomy bags are available there. Um, yes, okay, there are swim skirts are available. Okay, inner garments are available. Okay, all those things that you can. Okay, who told you that osteomates can definitely lead a normal life? See, these ostomy bags are nowadays very discreet and secure. You can use the term like ostomy bags are definitely discreet and secure. Nowadays, these are discreet and secure. Okay, they can live a normal life. Okay, there are ostomy bags, pouches are available. Okay, there are pouches available, innerwear, swimwears. Okay, these modern colostomy bags are discreet and secure. Okay, okay, it can be worn under any kind of clothing. Okay, okay, it can be worn under any sort of clothing. It can be worn on any sort of clothing. It can be worn under any sort of clothing. It doesn't mean that it doesn't mean an end of your life. Okay, it doesn't ostomy bags means it doesn't mean that an end of your life. It doesn't mean an end to your life. Okay, osteomates can lead a largely normal life. They can definitely lead a largely normal life. Okay, modern pouchings are available. Modern day ostomy bags are discreet and secure. Okay, you can wear it with any type of clothing. There are patterned skirts. Okay, and there are patterned skirts and bottoms available. Almost they will be having a flat lie. Okay, so they won't be obvious under clothings. So they won't be obvious under clothings. Okay, so there are swimwears available, inner garments available, patterned dresses. I mean, bottoms and skirts are available. So you could carry it anywhere. Okay, modern day ostomy bags are discreet and secure. You can use that term. Modern day ostomy bags are discreet and secure. They are discreet and secure. Okay, it can be carried everywhere. Okay, and almost they'll be having a flat lie, and okay, they'll be having a flat lie and won't be obvious with clothings and won't be obvious with clothings. That means not obvious means not pragadamalla. Okay, that will be already in a hiding position. Not be obvious under clothing, well, with clothings, and won't be obvious with clothings. There are swimwears available in a garments, pattern tops and bottoms are available, skirts and bottoms are available. So you can carry it anywhere. You can go to your classes. Okay, and can enjoy all the activities of your normal life. Okay, yes, all are getting me, my dear students, those who are watching me. Okay, that is what. Okay, so you don't have to, it doesn't mean an end to your life. It doesn't mean that. It doesn't mean an end to your life. Okay, it doesn't mean an end to your life. You can lead a, you can resume all your normal activities and can live a normal life and can lead a normal life, can have a healthy normal life. Yes, that is what. Okay, and you have to be very careful when it comes to, so in the task it is given like that question. Okay, in the task it is given like, then give brief instructions about the management of stoma and bag. You need to give instructions on the management stoma and bag. Okay, so that is what the question is there, Simone, that for the task, the last portion is like, then give brief instructions about management of stoma and bag. Well, I want to inform you one thing. You have to be a bit careful with the ostomy bags. You have to be bit careful with the ostomy bags. Okay, be gentle. Okay, whenever you are dealing with your ostomy bag, be gentle and clean the stoma with water. Be gentle and clean the stoma with water. Okay, never use any soaps or other perfumed components. Okay, and I want you to use always appropriate sized supplies. Appropriate sized supplies. Okay, change your pouch regularly. Change your pouch regularly and watch for allergies or infection, and watch for allergies or infection. Okay, so these are all the things that you need inform the these are all the things that you need to inform to the patient. See, these are certain points that you can use to these are certain points that you can use to cover that task. Okay, man, you can write it or you can listen to that. Well, fine. So what you can use is like, okay, so Mr. Martin, what I need to tell you now is to be, what I need to tell you is regarding the, what I need to inform you is regarding the back care. Okay, stoma management and back care. I want you to have a close watch over your colostomy bag and opening. Okay, I want you to have a close watch over your colostomy bag and opening. Always go for appropriate sized supplies. Always go for only appropriate sized supplies. The pouch has to be changed regularly. The pouch has to be changed regularly. Okay, you can use, be gentle while dealing with stoma opening and bag. Be gentle while dealing with stoma bag and opening. You can use sterile water, the clean water you can use to clean the area. Never use any perfume, scented or soaps. Okay, perfume, scented products or soaps. It can irritate the skin. And make sure that your the opening is intact. Okay, and see the color. It should be pink to red color. The opening should be pink to red color, and there shouldn't be any irritation over the skin. Okay, if you and there shouldn't be any irritation over the skin. Fine. Make sure that you um, empty the pouch regularly. Change the pouch regularly. Irrigate and change the pouch regularly. Irrigate and empty the pouch regularly and change the pouch regularly. Okay, so these are certain activities by which you can um, by which you can take care of the stoma bag. Okay, if you notice any nausea, persistent nausea, vomiting, blood stools, okay, any obstruction, okay, if you notice any blood stools, obstruction, yeah, okay, any sort of skin irritations, okay, risk for infections, elevated temperature, in those cases never delay, get back to the GP immediately. And in case if you notice something unpleasant like blood stools, okay, any skin irritation, okay, any color change, any discharges, okay, nausea, vomiting, okay, if you notice any of the signs and symptoms, never delay, get back to the doctor immediately. Get back to the doctor immediately. Okay, so this is how we need to. Are you getting me? So they'll be saying like, yes. So what do you say? Are you confident now? Will you be able to manage the things by self? Will you be able to manage by self? What do you think? What do you say? We are just asking the patient. And if you're having any concerns, see, I can arrange the supportive care services. I can arrange the supportive care services. Okay, there are stoma care nurses. There are stoma care nurses who are specialized in stoma care. There are stoma care nurses. I could, if you are okay, if you want, if you need, means I could arrange a visit by community support. I could arrange community support. Stoma care nurses are there. They will come to you and assist you in the care activities. And they will assist you in the care activities. What do you say? Okay, are you okay? So they'll be saying like, yes, Nas, I'm fine. Okay. Uh, so what do you say now? Will you be able to manage by self? Are you okay? Are you confident now? Hope you have got enough information. Hope you're clear now. Okay. I hope you understand. Hope you're clear now. What do you say? Are you confident in managing the things by self? Well, tell me now. So the patient will be saying like, yes, nurse, I will try. Um, I've tried to do that, but I don't think whether I'll be able to manage by self. That is what. You don't have to worry. Okay, now you can go back to your home. Okay, stay relaxed. Okay, keep your spirits high. Stay relaxed. Keep your spirits high, and try to put my instructions into practice. And try to put my instructions into practice. Okay, if you feel something abnormal, if you feel something difficult, or if you are in any need of help, you can come back after 3 days for assistance. Okay, if you're having any problems, then even if after going home, if you find it difficult to manage, if you have some problems or if you find it difficult to manage, you can definitely come back to us within 3 days. Okay, I could arrange you another assistance session. I could arrange you another assistance session. So this is how you should conclude the topic. Okay. So once after, I hope you're clear now. Well, what do you say? What are you? Are you okay? Are you? Will you be able to manage by self? Are you confident now? Hope I have cleared all your concerns. All those things you need to. Okay. So after giving all those instructions, after offering the assistance, well, how do you feel now? Will you be able to manage by self? Are you confident? I hope you will be able to do the things by self. Patient will be saying like, oh, nurse, yes, you have just cleared all my doubts. You have assuaged all my concerns. But I don't know whether I'll be able to manage myself. So at that time, don't worry. Don't worry. Okay. Just keep your spirits high. Try to put my instructions into practice and see what changes does it make. And see what changes does it make. Okay. In case if you're having any troubles, in case if you have any troubles, if you're concerned, if you're having any difficulties in dealing with your activities, don't don't worry. You can come back to us within another 3 days' time. You can come back to us within another 3 days' time. I could give another assistance program. Don't worry. Stay confident. Onas, thank you. Thank you. So we can finally. Okay. So I wish you a speedy. Okay. I wish you a better quality life ahead. I wish you a better quality life ahead. Okay. I wish you a better quality life ahead. Thank you for the visit. Feel free to contact if you are in need. Okay. I wish you a better quality life. I'm sure that you will be able to lead a better quality life. Or you can say like, I wish you a better quality life ahead. Okay. Okay. I wish you good health and better quality life ahead. Okay. Thank you for the visit. I wish you a better quality, okay, health, better quality life ahead. Okay. And feel free to contact if you are in need. And feel free to contact if you are in need. With that, you can conclude the portion. Obviously, the patient would be thanking you. They will be leaving the space. So this is how you should deal with this topic like this. It is quite hard, even though the things sounds or seems to be very simple. There are certain things that you need do. Okay, Mani Padmaja, Animesh. So thank you for your comments. I'm happy that you people were there with me for this much time. So please do watch. Okay, try to watch all those sessions. It would be definitely helpful for you. You can suggest to others, those who are in need. Okay, so please go through the topic and learn. Okay, I want all of you to practice and learn these things. Fine. So now I'd like to thank to my dear Vipin, Roshan, and Akash for their very good support. Without them, these sessions wouldn't be possible. Okay, I'm deeply indebted to all my dear colleagues, those who have made this session possible. Thank you, Vipin. Thank you, Roshan. And thank you, Akash. Okay, Mane Ashika. Thank you all. Okay, Mane Animesh. I'm very happy that you people are there. Do watch all these sessions, make use, and fetch us a A band. Okay, I want all of you to fetch us an A band. Okay, so see you all for next Friday session. Till then, take care. Bye.